Source. Thank you. The funding sources are here at the bottom of the slides for this session. We always want to start off with our sessions with this unconscious bias disclosure, and we want to just recognize that even in anything we talk about, we want to be mindful of language and the language you use. We use to make sure we're avoiding biases and that we avoid stigmatizing terms. So if there are any language that we use today or any terms that we use today that seems to be biased or stigmatizing, please let us know. We are all learning and we welcome your feedback. So for this session, I'm going to introduce Dr. Moore in just a second, and it's going to be an interactive session. So I would want to encourage all of you to have active participation. Join on video if possible. Be respectful and collaborative in the discussions, and share your approaches and strategies. We want to make sure we're using people or person first language, and that we create an environment of respect, balanced participation, confidentiality, but we're open to learning and take risk in our discussions and be vulnerable about our discussions. Will be a safe space for you to discuss whatever you want to discuss about as we go into this interactive session. And then during the Zoom, please take care of yourself. If you need to turn off camera, if you need to excuse yourself, or please take care of yourself while you're on this session. Here are the learning objectives. We're going to recognize different pathways that can be used for different reasons in implementation science, identify barriers and facilitators to implementation, map factors that affect implementation to a framework, and consider relevant strategies to support implementation. So what does all of that mean? So in the audience today, we have a collaborative audience. We have people in the audience that are from community. We have people that are from community organizations, health professionals, and we have researchers. And some people wear multiple hats. And so what we want to do today is, we know that many of you are part of changes or initiatives to improve health outcomes at different levels, and that sometimes you assess barriers and facilitators, and then select strategies to address these barriers and facilitators. But then we ask ourselves, then what? What do we do when we implement something or a strategy? And that's what we're going to talk about today. And this is where Dr. Moore is going to kind of take us into the world of implementation science and see how it applies to our world. All right. And then this is Dr. Julia Moore. She is Executive Director of the Center for Implementation, a social enterprise that trains, supports, and empowers individuals and organizations in applying theory and evidence-informed change methods to improve outcomes. She's internationally known for her ability to communicate complex implementation science concepts, and she's an expert on practical applications of implementation science. Her focus is on spread and scale of accessible training and supporting hundreds of change initiatives around the world. And so she's going to spend the next hour or so with us to share her knowledge and share how it may apply to us. So with that, I'm going to turn it over to Dr. Moore. And I think I have to stop share. There you go.
Awesome, thank you. All right, hold on, let me share my screen right here. Perfect. So hi everyone, my name is Julia and I am so excited to be here. So first I want to say, yes, if you want to turn on your cameras, I love to see people's faces. I made you really big so I can mostly only see your faces and nothing else on my screen. And it just makes me feel like we're like kind of in the same room, even if I am actually very far away from all of you. So I'm going to talk to you about implementation science today. And first I want to share really transparently, I'm really new to the world of HIV. That is not my area of specialty. I'm not a content expert. This is very new to me. My kind of focus has always been on what is the science of how we can actually implement new programs, new practices, new policies, and thinking about what that means at like this individual level, at an organizational level, and at a system level. And what I'm really excited about today is that I was trained as a researcher. but I've been kind of like a rogue scientist now for more than 10 years and trying to figure out how we can take this science of implementation and make it super, super practical and relevant for the people who are on the ground, implementing things, scaling things, supporting things, and now for the hundreds or thousands of researchers who are suddenly being asked to use implementation science in their research, but were never originally trained in what that was, or it probably didn't even exist when they were being trained. So I'm going to talk today at a really high level, because we only have an hour, about how to take implementation science and use that to guide the work that you're doing and how you can work together collaboratively. So I'm only going to scratch the surface, but hopefully we'll give you a couple of like takeaways or tools or ideas or frameworks that you can use in your work. Also, I want to flag, I live up in Canada and we have very bad allergy season right now, so I might need to sneeze or something. Although I have 2 kids and they were very excited that I was speaking to people from Texas, but we're hockey fans here and they want to say they're very sorry that Dallas got kicked out of the playoffs last night for you. So anyway, I want to also share that there is a handout. Perfect. Carrie just put the link in the chat. You can use your phone. And so you can go and access all of these different pieces of information that are in that handout. And that has like kind of lots of things you can take away. You can go, you can share it with your teams, talk through it with people. It'll kind of cover a lot of stuff. So when I think about implementation science, we're trying to make it really practical. So I like to start by thinking about roadmaps. These are like high level overviews of like, what are the kind of like key activities or the things that we do when we're going to implement things or do research about implementing things. What I love about using a roadmap is that most people realize that they're already doing the majority of things in this roadmap. So most of this stuff is not new. It's about finding 1 or 2 different ways of thinking about things, or maybe pulling a new framework or a theory in that helps us actually make it easier to do this work or to frame it or communicate it differently than we have been before. So we use 3 overarching pathways, we call them, to kind of provide an overview of like the roadmap of the kinds of things we do in implementation. I'm going to give you an overview of those, and then we're going to do our first activity together. So we're going to try to have some interactive activities, even though we have over 100 people in the room here. So the first roadmap that we have, or the first pathway we have, we call the relational pathway. Interestingly, I will admit that the field of implementation science is not totally there yet on the relational side. There's only some new research recognizing the importance of relationships, but anyone who has ever tried to actually implement a change anywhere knows that like relationships are central to all change work that we do, right? We can never create change if we don't have relationships with people. And so this pathway highlights kind of 5 key activities that we do when we're supporting change. We convene people, the act of bringing people together. So right now we are literally convening people, but probably all of you convene people for a variety of different reasons in the work that you're doing. When we bring people together, it's really good to define how we are partnering together. So we're determining the different levels of involvement that people have. And there are lots of great spectrums, for example, that categorize or group different ways that we might involve people. Next, we have governance. I'm going to admit this is like not my fave cup of tea. This is not where my brain goes. I'm not a governance person. But I recognize that if we don't clearly define things like how decisions are made, it means that we can end up in kind of challenging situations. And so really clearly outlining things like how decisions are made, whether that's through memorandums of understanding or terms of references, can really be helpful, especially when we're bringing together large groups of people. Then we actually do work together as a team and figure out how do we work together as a team to like make change happen across an organization or a system. And many of you, it sounds like, are not just working in one setting. You are trying to change the way that HIV is diagnosed, treated, managed. And so you are trying to work across the system. And so that takes an entire additional set of not just like how do we work as a team, but how do we work across the system? So this is the first pathway. The second pathway we have is a little bit more technical. It's one of my favorites because I think it's one of those things that we all do, whether we realize it or not, but we don't necessarily use a theory to do it. And I'll talk a little bit about theory in a little bit. So we call this one the strategies pathway. And I'm going to go over it really quickly now because we're going to talk about it more today. The idea of the strategies pathway is first, it relies on all these relationships, right? That's under the bridge. If you don't have relationships, stop, go back. You need to figure that out because you can't really move forward. But it helps us think about understanding how we're going to explore the thing. What is the thing that we're going to implement? Once we define or describe the thing we're going to implement, maybe it's a program or a guideline or a practice, we want to clearly define who is being asked to do something differently and what are they being asked to do. Then we want to think about what people's barriers and facilitators are. So why might they change and why might they not change? So that we can use that information to pick strategies that will support people to change and do those things that we would like them to do. And so we're going to talk today a whole bunch about barriers, facilitators, and strategies and how you can pick those. Once people have used this pathway, then we get to the third pathway, which we call the implementation, spread, and scale pathway. This one is completely nonlinear, as you might notice, and that's because this phase of implementation is nonlinear. You can bounce all over the place, back and forth, constantly. It involves doing things like identifying and building supports, like what are people's roles in the system, who's on the implementation team. You want to assess and address things like readiness and context. We want to plan for implementation, plan for adaptations, plan for sustainability. We want to operationalize our plans. So do things like pulse checks, or some places do PDSAs, plan, do, study, act cycles. And we want to evaluate to know whether what we're doing is actually working. So we like to start by thinking about those three high-level pathways and then zooming in on the activities within those pathways to kind of unpack what that might look like. Before we zoom into the strategies pathway, we want to jump into a quick activity using annotation. So can you kind of, if you're on video, can you raise your hand if you, or not on video, I guess, can you raise your hand if you've used annotation before? I'd like to just see kind of a sense of a couple people. Okay, lots of people have not. Okay, so I will introduce you to annotation. So it should say at the top of your screen, you are viewing Julia Moore's screen. Beside that, click View Options. Click the Annotate, and a bar is going to show up. Depending on the version of Zoom you have, it could be a horizontal or a vertical bar like this. And then I highly recommend picking the Stamp tool and making any kind of stamp you would like on the screen. Awesome. I see a heart, a check. Perfect. People are drawing. So there are also instructions in the chat, and I will walk you through it one more time. Right, all over this, we're going to use annotation a bunch today, so it's totally worth it to do, learn how to use it. If you have technological issues, please directly message Carrie in the chat, and she will annotate on the screen for you. So no one will know your name. You can annotate. My only tip is do not pick the arrow. It only lets you have one person using the arrow, and you essentially just erase each other's things and erase your name on the screen. So use the arrow is my only real tip. All right. I will give everyone 10 seconds to keep annotating, and then I will clear it and bring us to our first screen. Amazing. I love how many drawings there are. All right, I'm going to clear all these. So everyone pause for a moment. Okay, so pause, and I'm going to annotate again. Okay. Now, I'm going to take you to, oh, let me clear that. So, yeah, and if you're on a phone, it can be problematic. Some people say it works, some people say it doesn't. It has never worked for me on a phone, so I would just message Carrie and she'll post for you. Okay, so thinking about the relational pathway, Which of these were a strength for you? Put a little check mark or maybe even a heart if you want. And put a question mark beside things that you're like, oh, maybe I'd like to explore more. So check marks for things that you were like, yep, feeling like we do that really well. And question marks for things you'd love to explore a little bit more. Wonderful. Okay, so I'm seeing lots and lots of kind of like strengths in convening, partnering, and working as a team, which I feel like is not surprising. Maybe some people who, like me, governance is not your forte. And so shout out, I am like that as well. And then a lot of interest maybe in learning about working across the system, which is really, really exciting to see. All right, so I'm going to save that and then clear all of these and then take you to the next one. So now, same question, thinking about the strategies pathway, which of these do you feel like are strengths? And which ones are things that you're like, oh, maybe we could learn a little bit more about that? Okay, well, I am super, super happy. So it looks like along the pathway, it's like it starts out with a lot more check marks and moves to more question marks as we move along. And I'm super excited because we sometimes make a guess about where we should spend our time. And we are going to spend a lot of time today on barriers, facilitators, and strategies. And that is where there are lots and lots of question marks. So I'm really excited about that. All right, so let me save this. I will clear this one and take us to the last pathway. So this is the implementation, spread, and scale pathway. So the one that we use when we're ready to actually go and implement that thing that we've kind of designed. So which things do you think are strengths and which ones are things you'd love to learn a little bit more about? Ooh, I am loving this. It looks like people are actually pretty interested in learning about a lot of things in all of these different areas. Um, there's, a combination of check marks and question marks pretty much in every single one. So that makes, I don't know, those are lots of things I love to talk about. So we're not going to get into this pathway in detail today, but really, really good to see future areas and topics. So I'm going to save that. I'm going to clear all the drawings and I'm going to make it that you cannot annotate for a couple of minutes so that you don't disrupt the screen, but then we'll have another annotation activity quite soon. So as I said, we're going to focus today on the strategies pathway. And so when we think about the strategies pathway, we start by doing this first step, which we call explore the thing. And in most cases, I'm going to be honest, by the time people come and talk to us, they've actually already figured out what the thing is that they're implementing. And so based on our previous conversations, it sounds like some people might be doing things like rapid start, treatment injectables, and there's a variety of other kind of like programs or practices or guidelines that you might be trying to implement in your setting. Or if you're a researcher, you might be trying to evaluate or do research on the implementation of something. So I'm not really going to get into exploring the thing because oftentimes people have already figured out what that is. What we then need to do next is really clearly define who actually needs to do something differently and what exactly do they need to do. We find that people often assume that they have done this step and that they've done a really good job of this step, but we often realize that we actually have more who's that we haven't unpacked. And the more we can really clearly define who's being asked to change, the better we set them up for success. And one of my favorite examples of this is many years ago, I was working with a group that was implementing a hospital-based program. in surgery. And so it's this enhanced recovery after surgery program, super well established, very evidence-based. They were trying to implement it. They'd identified all these professional groups. And one of the big changes is that people are now allowed to eat and drink the night before surgery, which didn't used to be the case. But they were finding that all these patients were coming in and they were like, no, I haven't eaten since 7 p.m. last night. And they're like, why is this happening? The nurses are on board, the doctors are on board, like everyone is on board. What is going on? They did a little digging and discovered that the person who calls the night before surgery to say, hey, reminder, you have surgery in the morning, was saying, and don't forget, you don't want to drink or eat after 7 p.m. tonight. So it wasn't a clinician. It wasn't part of their core team, but it was this other person that they hadn't thought of that actually deeply impacted the behavior of those patients. And I feel like it's just such a beautiful example of how important it is to recognize all the people who are being asked to do something. And sometimes that's leaders, and maybe you just need them to support the change. But like, we don't need to be asking people a huge amount, but who are all the people and what are we asking them to do? And ultimately, so we like to call this the who and the what. So who is being asked to do something differently? And what are they being asked to do differently? And the better we can describe this what, the better we set them up for success. And when we know what we're asking people to do differently, that's when we start getting information about the reasons that they may or may not change. We like to call these reasons barriers and facilitators. It's like, why are they not going to do the thing that we've asked them to do? Sometimes we default to thinking, oh, if they only knew, or if they only got a reminder, they would change. But actually, we know that often it's other things driving the reason that people do or don't change. Things like their beliefs, or kind of just doing whatever their colleagues or their peers are doing. Or sometimes they're really afraid of trying something new, or maybe they're not confident. So when we can understand these barriers and facilitators, it can help us pick what we call change strategies, or the hows, how we can support them to change. And so we are going to unpack some of these barriers and facilitators. But in order to do that, in order to know what the barriers and facilitators are, we really, really need to define who's being asked to change or what are they being asked to do differently. And a small note about those who's and whats. Maybe some of you are unbelievably lucky and fortunate, and you have a very simple thing. Hand washing is one of those examples, I think, where you have a small number of who's and one simple what. And if you do, I'm so happy for you. But almost everyone ends up in a situation that looks more like this, where you have a thing and you might have 3, 5, 10, 12 who's, and each who is being asked to do a whole bunch of different things. And so unpacking all those who's and what they're being asked to do really, really, really helps us understand all the nuances of what we're about to implement. And then we use that to kind of take us to the next step in a moment of unpacking what are their barriers. Before we move on to barriers, we think it's really important to pause and make sure we've considered some key things. Have we defined the what's with people rather than for people? So were they part of the process of defining what that really looks like? And is what we're asking them to do actually feasible? Is it acceptable? Right? Because I think lots of people can think of examples where maybe it wasn't actually feasible to do what they were being asked to do. So how can we think through some of these different things? You know, is it feasible? Is it acceptable? Is it effective? And so can we pause and ask ourselves these questions before we move on to unpacking barriers and facilitators? Once we're ready, then we get into this next stage of barriers and facilitators, and it's one of my favorites. So when you start thinking about people's barriers and facilitators, you're going to start getting barriers and facilitators at a lot of different levels. Individual people have barriers, like reasons that they will or won't change. We also see barriers that happen at a team level. Like, ooh, you know, like we know that this interprofessional team has certain kinds of barriers, or maybe certain kinds of professions have certain kinds of barriers. We also encounter different organization level barriers, and you're going to have different system level barriers. So I know most of you are from Texas, and the barriers in Texas are probably different than the barriers from some of the adjacent states. And so understanding what those barriers and facilitators are locally can really help you. I want to know, I'm about to say the word barriers like 800 times in the next like half an hour, but do not forget facilitators. Okay, I think it's so easy. Our brains, there's even research, human brains want to focus on the barriers. We want to talk about the challenges. There are facilitators out there, and these are like clues that unlock how you can actually like make change happen. To me, these are like the keys to like making everything easier. So even when I say the word barriers 800 times, please also think facilitators, because we want to make sure we're thinking about both of them. Okay, so when we talk about barriers and facilitators, one of the best things to do is to talk about how we can use behavior change theory to think about barriers and facilitators. And I know that many people hear the word behavior change theory, literally want to like turn off their camera, shut the door, and like walk away. We even have people who've told us you are allowed to come present, but you cannot say the word theory in your presentation. But theory is part of what makes implementation science really work. It's the mechanism, it's the way in which we support people, organizations, and systems to change. So I'm going to present you a theory that literally my 11-year-old can understand, okay? So we can bring it and use it anywhere. If you have a different theory that you like using and it's working, continue using that theory. So we are believers, like use the thing that is working for you. But if you don't have a theory, this is a great place to start. It is called the COM-B. And the COM-B essentially says that in order to change, 3 things need to be happening. People need to have 3 things in place. First, they need to be capable of change. Like, do they have the knowledge and the skills to actually do the thing you're asking them to do? They need the opportunity to change. So they need to be in an environment that is supporting them to change. And they need to be motivated to change. I think that a lot of us love spending time on capability building, right? Everyone loves to train. Let's educate, train, build all these training materials for people. And there's an increasing amount of work put into creating opportunities. We think there's a huge opportunity, in fact, to unpack what motivates people to change, because we're not always thinking about that, is what is motivating people to change. If you're not yet feeling overwhelmed, I'm going to show you one more slide that's going to show a framework that links with this theory. If you're feeling overwhelmed with this level, pause, take a moment, just kind of close your eyes for the next slide, and then you can loop back, okay? Because some people want to stay at this level for a little bit, and some people want to go one level deeper. So the people who developed this theory in the UK, they linked this theory to a framework called the Theoretical Domains Framework, or TDF. And it essentially unpacks each of these boxes. So it says capability is made up of 4 things. Do people have the knowledge? Like, do they know they're supposed to do this thing? Do they know they are supposed to do rapid start, for example? Do they have the skills to do the thing they're being asked to do? Do they remember to do the thing they're being asked to do? And, or is it a habit? So earlier I mentioned hand washing. Hand washing is actually habitual behavior. We don't actually think about it that consciously, kind of like putting on your seatbelt. And so when something is a habit, we actually have to change it in a slightly different way than changing a conscious behavior. So these 4 things really unpack capability. What I love about the TDF is it gives us 8 different pieces of motivation. Beliefs about capability is saying, are people confident that they can do the thing they're being asked to do? It's kind of like skills, but a little bit different. Not can they do it, but are they confident? Professionals do not like doing things that make them feel like they are not super confident or competent in their jobs. Do people think it's part of their professional or social role or identity to do the thing that they're being asked to do? How many times do you might hear barriers like, ooh, is it really my job to do that? Right, so it'll fall right over here. Beliefs about consequences is asking, do people think a good or a bad thing might happen if they make this change? Closely related to that is the idea of emotions. Often people have very emotional reactions to being asked to do something differently. And when we can understand those, it can help us pick strategies that will support people. Goals and intentions are kind of two sides of one coin. Do you want to do the thing? And do you plan to do the thing? So I might say, I want to do a workout later today. That's a goal. Or I plan to do a workout at 6 p.m. That would be an intention. Is the current or new behavior being reinforced? So something saying, oh yeah, this is actually a good thing to do. And then we have general optimism or pessimism. So this is that kind of like, ooh, like if I just put my eyes down and like don't pay attention, this will pass just like everything else. And that kind of general pessimistic attitude that we sometimes see. And in opportunity, we have two things, but they're actually huge buckets. All of those environmental context and resource pieces, and the fact that we're often influenced by other people in the system. We actually use an entirely different framework called the Consolidated Framework for Implementation Research, or CFAR, if you know that one, to unpack this box right here. So we're not going to get into that in detail today because we use a whole other framework to do that, but it kind of gives you an idea of the different kinds of barriers that we see when we're thinking about those individual barriers. One last thought before another activity is, when we start thinking about barriers and facilitators, it is so important to not just guess, but to actually ask people what their barriers are. And that might seem obvious, but it's really easy for us to just make a guess and be like, oh, we think that this is the reason people aren't changing. But we need to actually have conversations with people to understand what barriers are they truly experiencing. And sometimes we need to link those individual barriers with the organizational and system barriers. So like, it's not just what an individual might be experiencing, but as people have already alluded to in the chat, there's things happening in Texas that might affect the combination of that person and living in Texas that impacts the barriers or their reasons for changing. And I noticed that there's questions coming in the chat. Carrie is going to take note of those and we'll loop back to those at the end because we have time for little questions at the end. So we're going to go back to another annotation activity. So I have a few examples of different barriers based on our conversations with the team here. And so we want you to kind of do a preliminary mapping. So you can pick any stamp you want, map it on here. If you feel comfortable at this COM-B level, just stick your stamp over there. And if you want to map down at this level, you can absolutely go for it. So remember, to get your annotation, you are viewing Julia Moore's screen, view options, annotate, you get your nice little bar, and then stamp away. Oh, sorry. And the actual quote is it really part of my job to do rapid start? That's an example of a barrier we have heard people have experienced. All right, so things are showing up in lots and lots and lots of different places. And so the first places I would go are a couple different thoughts. One is I would start by thinking, is this a motivational thing? Only because my experience has often been, this question is often motivational rather than a truly logistical question of like, is it actually my job? It's more like, oh, wait a second, I don't want to do that. Is it really my job to do that? And so the first place I would personally map it is this social professional role and identity. Kind of like that person saying, hey, is this really my job to do that? Sometimes there's actually also like a knowledge issue. Like actually it is a genuine question. Like, is that truly my job? I don't know. And I need someone to tell me that that is my job to do that thing. And so they need to know the knowledge and they need maybe someone like a manager to say, yep, this really is your job to do that. What I'm also seeing is lots of checks in other places, which tell me people are starting to think deeper. And what I love about barriers and facilitators is they're like onions. It's not my job is like the first layer of the onion. You're going to peel back that layer, and I can tell that people are already thinking about other reasons that are underneath. It's not my job. And the more we can peel back those layers, the better we can support people to really change. So I'm going to clear these and take us to the next example. Imagine someone says, I have worked here a very long time, and I keep forgetting to add all the rapid start stuff into my workflow with a client. Where would you put that? Amazing. Okay, so people are going exactly where I would go first. Memory attention, right? Like I don't remember to do this thing. And I think they're kind of implying like this is a habitual behavior. I'm just doing this out of habit. It's just my process. Like you're trying to make me change my process, right? So this is the place I would first go. But when people start doing other things, I think that there's probably another intention plan, like, oh, I'm not really planning to do this thing. Or maybe it's being reinforced a bit. I would start digging deeper and I would ask a probing question to be like, ooh, are they just saying this? Do they actually want to do this new thing? Like, is this an excuse? Or is this a like, I want to change, but I'm having problems with my process? Or is this a like, I don't really want to change, and I'm going to use process as my reason that I'm not changing? Next example. I started doing treatment injectables, and it's easier than I expected to keep it up. So this is not a barrier, but a facilitator. And so where would you put this one? Excellent. People are going exactly where I'd go. I think there's kind of three places I would default to, all in motivation. Beliefs about capabilities, kind of like, hey, look, this is easier. I'm actually growing in confidence the more I do this. I think that could be related to a general optimism that they might be experiencing just based on even the way I read the statement. And optimism is hard if you only see a statement, but if you talk to someone, you can feel the optimism, pessimism that might be going on. And to me, this is also a reinforcing behavior situation, right? Once we start doing it, we're like, actually, this isn't so hard to do. And that is really reinforcing. We know from behavior change theory that that really helps people keep doing a thing. All right. Next, we have, I'm really worried about putting all this work into the treatment injectables. I'm not sure it's going to work for most people. Awesome. All right. I'm going to try drawing this time. We'll see if it works. So a major shout out to the people who put it kind of in these boxes over there. That's really where I think I would go first is number one, huge shout out to the people who saw emotions. If someone uses an emotion word like worried, that is like huge red flag, right? Like this is a thing to make note of. Any emotion word, positive emotions, negative emotions, all the emotion words are so valuable when we're understanding barriers. If they're worried it's not going to work for people, that really feels like a belief about a consequence. And it feels like there might be a tone of pessimism here. We can't hear the tone, so we're making a jump and a leap here, assuming you heard that when you actually listened to people making a statement. All right, this is our very last one. Is someone says, I believe this is an important program, but I just don't have the resources and staffing to implement Rapid Start. Well, what kind of barrier or facilitator is that? What's a barrier, actually? What kind of barrier is that? All right, so I love where people are going. So the first place I think I would map this to is environmental context and resources, because they've directly said, hey, like I have a resource problem. the thing I always want to know is what's underneath that. So that is almost always true. People are going to tell you, I don't have time and I don't have resources. And that's pretty much true for every single thing that you're going to implement, because no one is sitting around with extra money, twiddling their thumbs for part of the day to wait for you to show up with a new program, right? Like that is just not what is happening. So we want to understand, okay, so if they don't have resources and they don't have time, let's understand what's really happening, and are there barriers underneath that? Do they want to do this? Do they believe in doing this? Are they confident they can do this? So really peeling back the layers underneath what's happening when we hear those resource questions. And so again, we have an entire other framework we use to really unpack resources as well, and kind of that contextual piece that I'm not going to be able to get into today. But I wanted to flag that one because I know it's super, super important. So once we understand people's barriers and facilitators, then we want to go and pick, oh, hold on, let me clear these and make it that people cannot annotate. Perfect. So once we can pick those barriers and facilitators, we want to go and pick strategies that are going to support people to change. And so that's kind of this last step of this pathway. And I am going to show you a tool. So Carrie can put a link here. You can use a QR code. I'm actually going to stop screen sharing and I'm going to stop screen sharing and start screen sharing again so that you can see this tool. Because I think you can't see it now. Let's see, stop. Oops. All right, so this is the link that Carrie has just shared in the chat. And so this is to an interactive tool that can help you pick different strategies to address those barriers. I'm just going to quickly show you how it works so that you can walk away and go and use it with your own teams. You do not need to explain behavior change theory in detail to people. When you go through it, we've often found people kind of get it pretty quickly when you talk about, let's unpack these barriers and pick strategies to address them. So the reason I talked to you about COM-B and the TDF is all of our strategies are mapped this way. So that say we have this barrier like, oh, it's not my job to do that. You might go in here and pick social or professional role or identity. We click on this button. And then it shows us the different kinds of functions or the purpose of the strategy we might want to select. So if people say, oh, it's not my job, we might need to educate them. We might want to model what it looks like to do the behavior well. Or maybe we want to persuade them that this really actually is part of their job. You then go click on the little dot. So say I pick persuasion. And then some options show up from the literature on what kinds of strategies can you use to persuade people linked through behavior change theory. And these are things that you have probably seen and or used in your actual jobs. Champions, engaging leaders, facilitation, identifying early adopters, coaching, leaders supporting the change, right? These are not rocket science. These are not totally brand new things. But what I think they do is they help us collectively think about what are the real barriers we're facing? What strategies can we use to address those barriers? And how can we really enact those strategies in a way that's going to support people? I want to flag, this is not a definitive answer. This has to be done collectively with people. So like, you might look at this and like, public demand or mass media might really not be the right answer for what you're doing, right? Because this is like a list that can work for people around the world based on any topic area. So it's like you need to sit down and make really thoughtful decisions about which of these is most appropriate and applicable for your context, right? So it's not an answer, it's a way to help you brainstorm and discuss this as a team. And one of the things I love about this is, say you pick a strategy like champions. I think that's really, really common strategy that people have. That strategy is a form of persuading. I can click on persuading and look at all of the different domains that this taps into. So one single strategy can help us do a lot of different things. So it's not that we need, you know, if we have 100 barriers, which is not crazy, right? We see that often. If you have 100 barriers, you don't need 100 strategies. You might have 5 to 8. That's the typical number we see is 3 to 8, but 5 to 8 is the most common. That can address a lot of different barriers. Maybe not all of them, but a lot of them. So I wanted to show this and show this as one way that people can go and find strategies to address the barriers you have identified. So I'm going to flip us back to this presentation. So thinking about this idea of understanding barriers, facilitators, linking it to strategies, change strategies using theory, we'd love to hear thoughts, I'll let you annotate again, of how you might use any of these concepts in your work. And so here you are welcome to type in the chat if you would like, and we can copy it onto the board, or you can use annotation again, but this time you could use the text feature and you literally can type directly onto the board to share some ideas of how you might be able to use this. We'll give you a couple minutes, and I'm going to look through some of these comments because there's great comments happening in the chat as well. Let me move these. Awesome. So I'm hearing things about community mobilization, figuring out who the implementer is, being thoughtful and systematic through consumer advisory boards, trial and error, gaps in outreach, people talking about using them with quality improvement, better understanding things on multiple different levels. And there were some great comments earlier about tailoring, adapting, and drilling down. And so we would absolutely agree. We actually think that this way of thinking about barriers and facilitators is a great way to support adaptations in a more systematic way that allows people to make adaptations without deviating from kind of some of the key things that we don't want to change, but giving us more room to figure out how we can adapt things to the local context and to meet the local barriers and facilitators we're encountering. I'm going to save this and clear it and share one last little piece of content before we open it up to questions. So I know some people here are researchers, and so I want to just flag one thing that can be really helpful for people who are looking to add implementation research questions to the work that you're doing. If you're not a researcher, you're going to see that you're actually probably thinking about lots of these things on a regular basis when you're implementing. So this is a framework called Proctor's Implementation Outcome. And it highlights how when we go to implement things, a program, we're often looking ultimately at getting client outcomes, right? Their satisfaction, symptomology, function, like is something improved? And in order to get this place, we need to improve the services that we're providing, right? So if we increased efficiency or equity or safety or patient-centeredness, like have we improved the services we're providing? And the implementation questions that we're asking are things like, ooh, is what we're doing, so this right here is implementation questions. Is what we're doing acceptable? Are people adopting it? Is it appropriate? What are the costs? Is it feasible? Are people having fidelity to it? They call it penetration. I like reach. So is it reaching people that it's intending to reach? And is it sustainable? And so I know some people are starting to think about how can I add implementation research questions into my work? This is a great framework to start. And I want to share 2 resources. And again, you'll have access to the slides so you can find these. This one helps you frame research questions, and this gives instruments to evaluate implementation outcomes. And we think both of those are really helpful for people who are kind of trying to figure out how to add implementation research questions into the work that you're doing. So I wanted to share those. Final thing before we jump into Q&A is I want to share, we have lots and lots of free resources. If people are getting excited about implementation science, what this could mean for you, there's a lot of ways to delve in more and or to share with your teams, because I know lots of people might say, oh, I want to bring this to more people. So we have things like a newsletter that you can just get new information. It comes out about monthly. We have a toolbox with lots of different things, including tools like the strategies tool I just showed you, and images. So lots of people like using our images. You can use them. You don't have to email us. Go ahead, use any of those images. They're on the website. And Inspiring Change is a free mini course. It takes about an hour, hour and a half to give people an overview of implementation. And if you want to talk about like the TDF with people, there's a little video in there about that. And so you could take that with them. And for people who want to go a bit deeper, we have a community of people who are supporting implementation who get together. So with that, I know that there are lots of questions coming in the chat. So I'm going to open it up if anyone would like to share questions. I'm going to go back up to these questions that Carrie asked, had flagged for me earlier, and then you can keep adding questions down below. Someone said, are we using theory for purposes such as context delineation, or are we using it as a sort of test? And I think the way you're using theory really depends on who you are and why you're using it. So some people are using theory, literally they want to test the actual theory. Some people are using theory to help them select the strategies that they're doing, which is what I explained. Some people are using theory retrospectively to see whether what actually happened was what they thought was going to happen. And so to me, it's really about figuring out, that's a tool in your toolbox. And it's figuring out, why would I use this tool? And am I using it for the right purpose? A purpose that fits. Someone asked about strength-based approaches versus consequence approaches. Also, the amount of health literacy is super important, whether it's primary care or behavioral health. So gaps exist regarding the definition of readiness for treatment. So that to me sounds like really great examples of barriers that you might encounter, right? Like health literacy seems like it's a big barrier you might encounter. And it's a barrier that you can probably unpack and get deeper and deeper and deeper to understand the nuances of how that's affecting them. In the same way that I think stigma is this like monster barrier that can be kind of like peeled back and really understand what's underneath that is really driving things. A bunch of questions about adaptation, flexibility. I could not agree more. We're in the process of building a new model to help people plan for adaptations, which should be out, I don't know exactly when, but it's called Map to Adapt. We're in the process of building it, and so it will be coming in the near-ish future. Someone said, how would you apply this to quality of life, and how would you start tackling it? I don't know enough to know how you would start tackling it, but you absolutely can apply it to quality of life. We have seen people apply this kind of process to hundreds of different areas, literally around the world, right? It's like a process that you can apply at a huge macro level, and you can apply it like, I have little kids, and like we can apply it at the kids, like what's the barrier to getting to bed on time? Do you know what I mean? Like what strategies would help address that barrier? So you can use it at like micro levels, and you could use it at like, we're doing systems change and entirely revamping the way that state delivers programming. So I think it's like the concept works at every level. You just have to kind of think through all the nuances. Someone said, in your experience, how important is it to define specific strategies? For example, Proctor. Okay, Linda, it is so important to define strategies. I wouldn't use Proctor's model to define those strategies, but you want to define those as clearly as you possibly can. Because when we tell people exactly what success looks like, it sets them up to be more successful. And when we tell them what a really good strategy looks like, it helps them do it really, really well. Oh, I just looked at the time and there are so many fabulous questions. We are at the end of today's session. So I just want to reiterate that slides and a copy of this presentation will be available so you can go and access all those things. The strategies tool is free. Anyone can use it. You can share it with anyone. And you can continue. I'll stay on for a couple minutes if people want to stay. But I want to thank everyone for all of your fabulous questions, insights, and annotations as we went through.
Thank you, Julia. Really appreciated just the clarity you presented in unpacking complex implementation processes. It's a great start. So I hope it's helpful to everybody. I'm Bijal Balasubramanian. I'm the co-director of the Institute for Implementation Science at UT Health Houston, and along with the DC FAR, we're really excited to bring this practitioner-focused presentation and resource to you guys. As it was mentioned before, next slide, please. As it was mentioned before, it's a collaboration of many institutions, and we also are in the planning stages for a workshop to follow that Julia's team will lead to follow this presentation. So if you're interested, please share your feedback in the survey link that was put in the chat. And thank you again. I hope all of y'all have a great time today.
I'm gonna leave the meeting on for a couple of minutes just so people can get the chat, the REDCap survey link, and if they have any other questions, and I'll close out at 2:05.
Perfect. Thank you, Sudra.
Thank you, everybody, so much for joining.
Thank you. Bye.
Thanks, Julia. Bye.
Oh, I thought Bijou would stay on and Carrie and Julia.
I was just sending them a message, but they hopped off. I'm not sure if they have stuff.